Thank you very much. It's a pleasure to be here and present on behalf of Derriford Hospital in Plymouth. The background to this study was from an M&M meeting, actually. We sat and discussed some deaths one morning, and we realised that all of the deaths on that day were anaemic to start with and received a lot of blood. Summary of the literature reviewed that low baseline haemoglobin is an independent predictor of the risk of major bleeding and death and heart attack, increases mortality, is a risk factor, and increases adverse postoperative events. So we wanted to look at the impact of preoperative anaemia in patients awaiting urgent coronary bypass. So in patients looking at blood products transfused, red cells, FFP, platelets, hospital bed days split into intensive care stay and ward stay, and importantly, the cost. So we looked at all patients who were inpatients awaiting surgery with critical unstable symptoms or a critical anatomy for 1 calendar year of 2011. The groups were split according to males with haemoglobins below 13 and females with haemoglobins below 12 being anaemic and all others being non-anaemic. We looked at patients' gender, age, risk stratification, length of stay, transfusion and reoperation. We used the Mann-Whitney-U non-parametric testing because of the differences in the groups and the chi-square test with the Yates correction. So our data set was 173 patients. The anaemic group, 26% of them, 46 patients in total. The similarities between the two groups were bypass times, number of grafts performed, number of diabetic patients, and, morbidity, not mortality. The ages of the patients, the females and the non-anaemic males averaged 67, 68 years, and the anaemic male group were the highest at an average of 73. The risk stratification, the median for the non-anaemic group was 5, and for the anaemic group was 7, and the averages are there on the right-hand side of the slide. Length of stay, first of all, in intensive care, very significant. The median was 1 day for both groups, but as you can see in the anaemic group, there were significant amounts of patients that stayed for a long period of time, up to 6 days. This is the same graph shown in a pictogram. So the numbers of patients that stayed for just 1 day on the left-hand side, the non-anaemic group, was significantly greater than the other group. We looked, as a matter of interest, at the fast-track patients going through ITU. In the non-anaemic group, almost 20% of them fast-tracked through ITU, so within 4 to 6 hours. And in the anaemic group, only 6% of those patients, and that has an impact for our electives and the rest of our patients. Length of stay on the ward, a median of 6 days for the non-anaemic group and 8 days for the anaemic group. And this is just a chart to demonstrate the average. So the average length of stay on the ward, the anaemic group stayed an extra 1.5 days at an extra cost of £250. And in intensive care, the anaemic group stayed an average of 1.3 days longer at an additional cost of £1,820. On to the red blood cells. This was a very interesting part of the study. The non-anaemic group had a median of 2 units per patient, and the anaemic group had a median of 4 units per patient. So on average, the anaemic group used twice as much blood as the non-anaemic group. This is the same data on a pictogram. Interesting that nearly 40 patients of the non-anaemic group received no blood at all, whereas only 3 patients in the anaemic group received no red blood cells. FFP transfusion, there was not a great deal of difference between the two groups. However, in the platelet transfusion, there was a slight trend towards significance. 67% of the patients received no platelets on the non-anaemic side, and on the anaemic side, 50% received no platelets. This is a summary of all the blood products given. We actually didn't cost the other blood products given because there were very few patients within the 173 that received them. One interesting point was that 71% of our non-anaemic patients received blood transfusions, which was quite a shock to my colleagues. Reoperation, there were 6 patients that came back for bleeding, graft problems, or that wasn't significant within the study. So, in summary, our anaemic patients tend to be older. They tend to have higher risk scores. They tend to stay in ICU and the ward longer than the non-anaemic patients. They, on average, use 50% more red blood cells. They tend to use more other blood products. They tended to have poorer LV functions and cost, on average, nearly £2,500 per case, more than the non-anaemic patients. Thank you.